Approximately 28 million Americans have sleep apnea. Now, there's already a proven association between sleep apnea and increasing your risk for heart disease, high blood pressure, stroke, diabetes, obesity. But now there's a new study that's also found to increase the risk of cancer. Here to tell all about this is Dr. Schwimmer. You know him. He's from the Snoring Center. Hello, Craig. How are you?
Great, Amy.
This is frightening. Doctor, we talk about sleep apnea, and it's frightening how this could be related to so many incidences, but now cancer. What's going on?
Yeah, it's really quite remarkable because we've talked, there's a long-standing association between sleep apnea and increased risk of stroke, high blood pressure, heart attack, diabetes, obesity,
right.
And those things have been well documented for a long time. Two new studies have just shown that having sleep apnea increases one's risk of dying from cancer, and that's really quite remarkable and quite frightening.
Oh my gosh. Okay, we'll talk about sleep apnea a little bit, because if you don't have a bed partner and you're sleeping alone, you may not know that you have it.
Right. So most people have a bed partner, and so loud snoring, witness stop breathing spells, those are the hallmarks. That's what that most people are made aware of. But if you don't have somebody telling you or you're not sure, things to look out for are unrefreshing sleep, right? People with sleep apnea don't get normal sleep, so they wake up in the morning and they're tired. Daytime sleepiness, a dry mouth in the morning from all the snoring.
Yes.
People with high blood pressure and poor sleep, those are people that really ought to look into the possibility of sleep apnea, because the health consequences are so dire. Okay,
because so many people might think their snoring is unrelated to sleep apnea, or maybe it's not that severe. Maybe they don't have a bed partner that's telling them this is frightening when this happens. When do you know you need to seek treatment? Well,
you know, the lesson from all of these studies is early, and because 10% of adult men are estimated to have sleep apnea, really, if there's a concern, if you're not getting a good night's sleep, if you're tired during the day, if somebody's complaining about your snoring, get it checked out.
Okay. Is it more prevalent in men then?
It is. It's almost twice as common in men as in women, but there are plenty of women who not only snore but have sleep apnea. A third of our patients at the Snoring Center are women.
Okay. Do we prevent this in any way?
You know, weight loss obviously helps, but getting treated is, other than, you know, diet, exercise, being healthy, trying not to be overweight, this is a disease that, like others, just needs to be treated.
Needs to be treated, okay, but that's where the good news comes in. That's where you're here for. So talk about treatment options for those who are suffering.
So the good news is, yes, there are a variety of treatment options, and fear over undesirability of treatment options should not prevent somebody from getting tested.
We're so afraid of pain and uncomfortable.
Right, and so many people think that, well, there's one way to treat this, you know, the mask, I can't do that, I don't want to do that. There are other options, and really the message here is sleep apnea is associated with a whole variety of health issues. Get it checked out, and there are treatment options that you can find acceptable.
And the mask, the CPAP, that's just one way of treating sleep apnea.
And
some people are very successful with that.
Absolutely, and if that worked for you, that's great. If not, there are other options.
Okay, and some of those options are?
So traditionally surgery, and now, of course, minimally invasive office-based treatments.
Okay.
That's what we do at the Snoring Center, and that's really helpful for a segment of the population. The biggest message is, it's less important how you treat your apnea than that you diagnose it and treat it.
That you diagnose it. Okay, so they call the Snoring Center, they come in, and there's a consultation process. How do you kind of diagnose that this is going on?
Thorough history, physical examination, and then very often we'll do a sleep study, and we'll talk more about diagnosing sleep apnea next time. But the good news there is that it is no longer necessary to go and spend the night at a sleep lab. Many people can get a sleep study at home. So it's much more convenient. You get a more representative night's study.
Are you going to someone's house and watching them sleep?
No, you send them home with, it's technology. It's the march of technology. You send them home with a little portable monitoring device.
So cool. That's way better than you having to make so many house calls, Dr. Schwimmer. Awesome. Thank you so much for giving us some information on this very important topic. And if you need more details on sleep apnea or Dr. Schwimmer, just log on to that website. It's easy, snoringcenter.com. Over to you, Carrie.
All right, Amy. Thank